Good morning. Can you hear me?
Yes, sir.
Okay, right. So we can start. Uh, right. So this lecture will be on cardiovascular regulation, relatively lengthy lecture. So of course, I prepare details slides, so you can read some of the slides which I will not describe. These are the ILOs. When we get the cardiovascular system, you can understand now the purpose is to maintain good blood flow to the tissue, right? But the requirement of this blood flow is not same. It will change depend on the requirement and depend on the situation. As example, in some when the somebody is resting, heart rate might be 70 and stroke volume can be 70. But if we start to run or do something, heart rate will increase, stroke volume will increase, because we need to provide more blood to the muscle, active muscle. Same time, when he start to rest again, it will come back to the normal level. The same way, if there's a blood loss, bleeding, considerable blood loss, when we lost the blood, we need to still continue the good blood supply, good oxygen and nutrient supply to tissue. So with the blood loss, with the bleeding, again, heart rate will increase. Of course, stroke volume probably will not increase and blood pressure will not increase because of the blood loss. So, but still, we can increase the heart rate and try to maintain good blood flow. So that is the regulation. So always the things will alter and we need to change depend on this requirement. So therefore, the purpose is to maintain good blood flow at least to vital organ like brain, heart and kidney. To do that, we can adjust few things. One is we can change the cardiac output. We can change the heart rate, we can change the stroke volume. By doing that, we can change the cardiac output. Same time, we can change the blood vessels. Especially we have set of blood vessel called resistant vessels, arterioles and venules. Set of, not all blood vessels. Some blood vessels we can change the diameter, by that way change the resistance. So peripheral resistance. In the same time, we can reduce pooled blood. That means some blood will not really contribute to main circulation. They will retain there, or less contribution to main circulation. We call pool blood. Pool එකක් වගේ හොය තියෙනවා. So we can get this pool blood to the main circulation, or we can reduce the pool blood and push them to main circulation and get them to a to maintain cardiac output. So these are the things we can change: cardiac output, diameter of some blood vessels, and we can alter the amount of pool blood. Right. So of course, all these mechanisms are very important when we managing patient. If somebody with heart failure, circulatory failure, or shock, cardiovascular, or hypolimic shock with loss of blood loss of blood volume, and patient with autonomic dysfunction, we need to understand this physiology when we managing these type of patients. So that is why we learn them in your preclinical days in physiology. Right. So just to emphasize few things, when we regulate the cardiovascular system, we can regulate blood vessels, right? As I mentioned earlier, we can increase and decrease the diameter of some blood vessels. Of course, you can understand heart and blood vessels. So some of the blood vessels that will enter to this is a muscle, we can control these blood vessels. Then we can control the heart. That means we can control the cardiac output by altering heart rate and stroke volume. So we can control blood vessels, we can control heart. These two control we can regulate externally. That means there is a commanding center somewhere in the brain, some sort of commanding center, both is highly integrated. So blood control of blood vessel, control of heart can be regulated, monitored in a one place, right? So it's a very well regulated two things. Then inside the muscles, inside any tissue, in this case muscle, local blood flow also can be regulated. But that regulation is purely local. Externally, we cannot control them. This local regulation, this tissue level regulation is up to extent is local. Externally, we cannot regulate. So inside the tissue, in this case, inside the muscles, there are some other local regulatory process, right? So these three broad process you will study, you will understand in this lecture, right? Okay. So regulation, as I mentioned, we can regulate blood vessels and heart. Of course, we can regulate local regulation. We can do the local regulation and systemic regulation. When we call systemic regulation, that means blood vessels and heart. Through the systemic regulation, we can do through the nerves as well as hormone. So let's see about the blood vessels. For the blood vessels, we have local regulation. So that's what I mentioned. In these blood vessels inside the tissue, we can regulate locally as well as systemically, we can regulate blood vessels. So blood vessels, we can regulate locally and systemically. So local regulation, I will explain later. We can call autoregulation with vasodilatory metabolites and some substance secreted by locally in the endothelium and other places. Systemic regulation of the blood vessels, to do that, we have two components. We have neurons, sympathetic, parasympathetic. That means basically autonomic nerve system will control the blood vessels throughout the body. Right? So that is systemic regulation. Then hormone like adrenaline, noradrenaline, vasopressin, angiotensin 2, like hormone will regulate the blood vessels throughout the body. Right? So that is we call systemic regulation of blood vessels. And this is purely local regulation, only inside the tissue. Right? This systemic regulation or central regulation, we can control outside through the brain, some commanding center or something, right? So first we will see systemic regulation of blood vessels, right? When we say systemic regulation, as I mentioned earlier, we have neuron, nerves, basically autonomic nerve system, sympathetic, parasympathetic. That's the regulation of this blood vessel through the neuron. Then we have regulation by the hormone. We have set of hormones, vasodilatory hormone and vasoconstrictor hormone. So when we say hormone, probably you learned in the advanced level or even before that, usually hormone is secreted by a gland, and then it will transfer to the site through the blood. So usually hormone will come to the site or target tissue through the blood. So that is why we call in Sinhala you learn Antara Sarga Gantha, right? Antara Sarga Granthi or Antara Sarga Paddhatiya, because it will come through the blood. So vasodilatory substance and vasoconstrictory substance, these are hormone secreted from other places. You know, epinephrine, norepinephrine, adrenaline, noradrenaline, those things secreted from adrenal gland and some other places, vasopressin from the brain, angiotensin 2, some other place, like that. So vasodilators like kinin, ANP also coming from some other places, but they will come through the blood to the tissue. So therefore, those are not the local regulation, right? Because it's coming from outside. So in the blood vessels, local regulation through this hormone, through the neuronal or autonomic regulation, we have two types of blood vessels, mainly two types of blood vessels we can control through the nerves, right? Through the arterial system, we have arteriole. We can control through the autonomic nerve system, right? In the venous system, we have venules, we call capacitance, right? Capacitance veins, so venules, and arterioles we call resistance artery. right? So these places we can control through the nerves. This place we can control through the nerves, but not here. Aorta, large artery, small artery, we cannot control. Vein, great veins, we cannot control. So you can understand in our circulatory system, arterial system, venous system, only certain places we can control, right? One well-known place is arterioles and venules, right? So by providing autonomic supply, right, sympathetic, parasympathetic supply to these places, we can constrict or dilate these arterioles or venules. By that way, we can control the blood flow to finally to capillary, because capillary, where we get the blood from capillary tissue get the blood, right? Okay. Right. So to regulate the blood vessel through the neurons, we have noradrenaline secreting nerve fiber. Right. Basically, sympathetic nerve fiber that secrete noradrenaline at the nerve endings. So probably you know when a hormone or neurotransmitter secrete, it should go and bind with the receptor, bind to the receptor, and then only it will do something at the cellular level. So here also noradrenaline will secrete and bind with noradrenergic receptor, we call alpha 1 receptor or maybe beta receptor. Then it will activate smooth muscle in the blood vessel, right? No, so a noradrenergic fiber we can find throughout the body. Arterioles and some mainly arterioles get the nerve supply with the noradrenergic fiber, and they act on receptor in the smooth muscle, right? So noradrenergic fiber vasoconstrict will do the constriction through the alpha 1 noradrenergic receptor or adrenergic receptor. So as I mentioned earlier, they will let's say this is noradrenergic fiber, and that will secrete the neurotransmitter, and there is a smooth muscle, let's say this is smooth muscle with the receptor for this neurotransmitter. So this neurotransmitter go and bind with the receptor and constrict the smooth muscle. So this receptor is alpha 1 adrenergic receptor for the vasoconstriction, right? The same time, we have vasodilatory fibers also. So this is basically we call vasoconstrictor fiber. Some places, especially skeletal muscles, will get adrenergic, that means sympathetic, vasodilatory fibers. So when they bind with the receptor, actually it will relax the smooth muscle in the blood vessels, smooth muscles in the blood vessels of the skeletal muscle, right? So therefore we call vasodilatory system, right? This vasoconstrictor system is available throughout the body, but vasodilator system is limited to skeletal muscles and few other places, right? So remember then, adrenergic, that means sympathetic neuron provide supply to a blood vessels throughout the body, that is vasoconstrictor. But some places we have vasodilatory fibers, right? And this vasoconstrictor system provide tonic activity. That means always this nerve impulse coming through this vasoconstrictor system. Always some nerve impulse come, right? Some amount nerve impulse come and keep the tone of this smooth muscle constant. If the nerve supply through this sympathetic vasoconstrictor system increase, vasoconstriction will occur, blood vessels will constrict. If the nerve supply rate, number of impulse coming through this system reduce, opposite will occur and vasodilatation will occur. That is why we have tonic control on the blood vessels, right? So remember that, that is important. We have tonic control in the vasoconstrictor system in the blood vessels. Right. So this is a summary. You already learned about the sympathetic ganglia, the sympathetic ganglia, acetylcholine, and then postganglionic neurons secrete noradrenaline, alpha receptor act on blood vessels and do the vasoconstriction. Other than noradrenaline, we have some other neurotransmitter also. That means nerve endings will secrete some other neurotransmitter like VIP, neuropeptide, substance P like neurotransmitter also, but they are not common. Common type is noradrenaline also secrete from the nerve ending, right? So up to now, I try to explain the systemic blood vessels regulation through the autonomic nerve system or through the neuron. Now I will move to the systemic blood vessel regulation through the hormone. So what are these hormones? I already explained vasodilatory hormones. We have vasoconstrictor hormone, right? So they will secrete from distant places and come through the blood. It will come to the target area and activate the receptor again, right? So activate the receptor on smooth muscle, basically. Smooth muscles of the blood vessels, right? So these hormones are, again, as I mentioned earlier, noradrenaline or norepinephrine is secreted from nerve endings in the sympathetic nerve system. In addition to that, noradrenaline will secrete from adrenal gland. Matakai adivukka majjava, not the bike, majjava, adrenal medulla, right? It's an endocrine gland, secrete adrenaline and noradrenaline. So this adrenaline will go to the blood and will through the blood, it will come to the tissue and bind with the receptor in the smooth muscle. So this noradrenaline as well as adrenaline act as a hormone also. But here I describe it as a adrenaline, or no, basically noradrenaline, I describe as a neurotransmitter secreted from nerve and bind with the receptor. But here I use it as a hormone. That means it coming through the blood from the adrenal gland, right? So, but mainly adrenaline is the hormone that coming from through the blood and act as a hormone to control the blood vessels. Noradrenaline mainly released from nerve endings. But this noradrenaline release from nerve endings will probably will come to the blood and might act as a hormone also, right? But mainly adrenaline is coming from adrenal gland, act as a pure hormone, will distribute through the blood, right? Okay. In addition to adrenaline and noradrenaline, some other hormone also will come through the blood. There's a hormone called kinin, two types of kinin, bradykinin and lysyl bradykinin. They are tissue hormone actually, it's only small amount can be found in the blood. So they are not really from real endocrine gland, but secrete from some places in the tissue and will act as a hormone. Then ANP, atrial natriuretic peptide. So that is interesting hormone. Actually, it's this hormone secreted from heart. So heart is not an endocrine gland, as you already learned. Heart is basically a gland in the cardiovascular system, but mainly atria. So heart will secrete atrial natriuretic peptide and act as a vasodilator. Basically, it antagonist. Antagonist mean will do the opposite action of vasoconstrictor agent. So it will dilate, and we can call ANP, atrial natriuretic peptide, is a potent vasodilator, right? Okay. So, and as a list of hormone, we act on blood vessels, we already learned vasodilators and vasoconstrictors, right? Main vasoconstrictors are noradrenaline. Of course, most of the noradrenaline secreted from nerve ending, but we can consider this as a hormone because some might go to the blood and will distribute through the blood also. Then angiotensin 2, vasopressin, ADH, probably you learn ADH, in advanced level, vasopressin no ADH, adrenaline secreted from adrenal gland, act on skin and some other places. Then dopamine also secreted from adrenal gland and some hormone, right? You might see this as a big list, but you will learn this hormone in some other places also. So don't worry. As angiotensin, you will learn in the renal physiology. Vasopressin, you will learn in the endocrine ADH. Adrenaline, again, in some other places. So these are vasoconstrictors. Vasodilators, adrenaline, in some places, it will act as a vasodilator, skeletal muscles and liver. And some places, it will act as a vasoconstrictor, same adrenaline. Dopamine will act as a vasodilator in the kidney. ANP, I already explained, atrial natriuretic peptide secreted from heart, very good vasodilator. Then VIP, kinin, substance P, those are vasodilators, right? So these are hormone act on receptor in the skeletal muscles, vasodilator or vasoconstrictor, right? Okay. Then, so far, I try to explain the blood vessels systemic regulation. That means these blood vessels can be regulated through the autonomic nerve system. That means through the nerves, sympathetic, mainly sympathetic, and through the substance, that means hormone secreted from basically from endocrine gland and some other sources. Now, same blood vessels, when it enter the tissue, we can control them locally. So far I explained the regulation, not locally, systemic regulation. That means centrally regulate, centrally control, coordinated, basically operate outside the tissue. But inside the tissue, in this example, muscles, we have local regulatory mechanism. So that's this one I will explain now, local regulation. So local regulation mean it's like a central government and Pradeshiya Sabha, as you can understand. So in central government, they will control health and education in the country and defense, Arakshav and foreign policy and main roads like highways and so on. Central government. Local government like Pradeshiya Sabhava in your area, they will control the garbage collection in the local area and small local road development and those things. So that is local regulation. They will do locally themselves. Maybe some of your neighbor selected as a Pradeshiya Sabha Mantri and you can influence them. So basically it's a local regulation, right? So in the local regulation, we regulate the blood flow locally. So basically, because of the local regulation, even we get the less blood flow from outside, we can control locally and maintain it in the constant level. And this is good example. So this is arterial pressure and blood flow to a tissue. You can see arterial pressure fluctuate here from let's say 75 to 200. In this range, blood flow will constant, right? Basically constant because of local regulation. Outside blood flow is reduced, right? Arterial pressure reduced, basically. Arterial pressure reduced, but local blood flow will maintain because of the local regulation, right? So we have two mechanisms for the local regulation: acute control, very rapid to maintain appropriate local tissue and blood flow; long-term control over period of days, week. We have this local tissue mediated control. There are several mechanisms for local regulation. One is the metabolic theory or metabolic substance. So that means basically the metabolites we produce in the tissue, like carbon dioxide, H+. We know that, you know that we produce a lot of carbon dioxide in the tissue level, right? So this carbon dioxide and we produce H+, right? With the metabolism of with metabolic activity, anabolic oxidation, and carbon dioxide can convert it to carbonic acid by that way also H plus. So we produce a lot of H plus and carbon dioxide locally due to metabolic activity. These metabolites will act as a regulator of the blood vessels. So that is the metabolic substance or metabolic theory. In addition to that, we secrete some substance locally, purely locally. All right. The substance you learned earlier, it's hormone coming from outside. But some substance like nitric oxide, thromboxane, prostacyclin, these are product of local tissue product. Endothelium or some other places, they will secrete and they will act as a vasodilator or vasoconstrictor. Right. So these are purely locally regulated mechanism. Right. So vasodilator substance secreted or produced by the metabolism. So when the tissues are more active, we will produce these metabolites like carbon dioxide, H plus, and potassium. We produce large amount when our tissues are metabolically active. As example, in the muscles. When what are the situation where muscles are metabolically active? කියන්නක example එක. Muscles active වෙන්න මොන වෙලාවටද? Huh? Hurry up. Don't waste time today. Nobody answer. Muscles active වෙන්න මොන වෙලාවටද? Muscles වල metabolic activity වැඩි වෙන්නේ. Yes.
While contraction.
Yes, when contracting, when you are running or when you are active, when you are jumping, muscles are active and metabolites will produce more. Carbon dioxide will produce more in the muscles. H plus will produce more in the muscles. Potassium will produce in the muscles and oxygen will be low in the muscles. All these will dilate the blood vessels. So that is what we call it. These are metabolically active vasodilatory substance. What are they? Carbon dioxide, H plus, potassium and those things. So these metabolites and lack of oxygen will act on precapillary sphincters, meta-arterioles and arterioles and dilate the blood vessels. So you can now understand when you are running inside the muscles, you produce more carbon dioxide, more H plus, more potassium. This will act on these places in the muscles and dilate. Then we get more blood to the tissue, right? So that is how vasodilatory metabolites act, and when we get the blood flow, probably these substances will wash out and can come back to the normal, right? So these substances, as I mentioned, carbon dioxide, adenosine phosphate, histamine, potassium, H plus, adenosine, lack of oxygen, pH, reduced pH mean H plus, and temperature also act as a also has a vasodilatory effect. That is metabolic theory. Right. So later, try to answer this question. What are the main modes and ways we can control blood flow to a cell located in the distant places? Let's say, just consider the cells in the muscles. What are the ways we can control the blood flow to this cell? And in addition to metabolites, there's a theory called myogenic theory, which is not very important, operate only mainly in the renal blood flow. And you can read that. It's a separate concept. I will not explain in details. You can read that. Remember something called myogenic theory. It basically say when with the blood flow reduce, it will do the contractile property or reduce stretch and will dilate blood vessels and make it high blood flow. Right. So for the local regulation, I explained about the metabolic substance operate mechanism. Then, as I mentioned earlier, we have substance really secreted from locally. right? These metabolite substances are not really secretion. They are just product of the cells. But really, we have local secretion that will act and that can act on blood vessels to dilate or constrict the blood flow, right? That also belong to local regulation, but it's not a auto-regulation. We don't call it auto-regulation or metabolic mediated regulation. This is a substance-mediated local regulation. These substances are prostacyclin, thromboxane, A2, and nitric oxide mainly, right? So prostacyclin and thromboxane A2 are two substances, but they are at a balance. When one is increased, it will dilate. When other one is increase, that will constrict. So therefore, they are at the balance to maintain good tone or good diameter of the blood flow, right? Prostacyclin and thromboxane action. And for the function of platelet also, that is important, especially aspirin treatment. Through the aspirin treatment, we maintain balance of prostacyclin and thromboxane, and read about the effect of aspirin and action of prostacyclin and thromboxane on aspirin. Please read, it's in the Ganon, because aspirin treatment is clinically important, right? So that is something else, but platelet action is something else, but this action will dilate or constrict the blood vessels. Then we have very potent vasodilator called nitric oxide. I think you learned in the nitric oxide in the advanced level. So nitric oxide acts as a neurotransmitter as well as this endothelium secreting blood vessel relaxing factor, right? Early name as endothelial derived relaxing factor. Later we realize that is nitric oxide. There are two isomers, NS1, NS2, NS3, and they will act on endothelium, right? Mainly NS3, and do the dilatation of the blood vessels through the nitric oxide. Nitric oxide release is constant, continuous release, and clinically it's important when we treating patient with myocardial infarction and maintain good blood flow in the coronary artery. We use drugs called nitroglycerin, GTN, maybe your parents, grandparents might use that. So they will act through the nitric oxide, right? ඔගොල්ලෝ සමහරට අහලා ඇති දිවයට තියාගන්න පෙති කියලා જાතියක් තියෙනවා. Those who had a heart failure, myocardial infarction. So they will act on through nitric oxide. And then there's a drugs used for impotence, sexual dysfunction in the male, sildenafil, or Viagra trade name. They also act through the nitric oxide, and read that also, right? So read about the action of GTN on cardiac blood vessels, and sildenafil action on the impotence, again blood vessels in the penis. Other than nitric oxide, we have something called endothelin 1. That is vasoconstrictor, right? So nitric oxide is a potent vasodilator or relax the blood vessels. But endothelin 1 constrict the blood vessel, both secrete from the endothelium or secrete from the locally in the tissue level. Right. So later again try to list the substance which act on blood vessels and their effect. So you learn many substances that will act on blood vessel. Some of them are local factors like nitric oxide, endothelin 1, prostacyclin 2, prostaglandin, and so on, right? Then you learn some of them act on blood vessels as a hormone, like vasopressin, adrenaline, noradrenaline, angiotensin 2, ANP. So list all this, and that will be very helpful for your later. I mean, when it come to the close to the exam, you will forget everything and make a jumble, right? So therefore, make a list and keep it somewhere. Vasodilatory substance, vasoconstrictor substance, local substance, and hormone, right? So that will be helpful for you try to do that later. Right. So up to now, probably you can understand, I discuss only the regulation of blood flow or blood vessels. Systemic regulation for the nerves, hormone, local regulation through the metabolites and locally secreted substance. Now I will move to think about or describe the regulation of the heart. Right? So regulation of the heart. So heart can be regulated again through the nerves as well as hormone. Right? For the regulation of the heart or cardiac regulation, we have noradrenergic sympathetic supply. That means sympathetic nerve secrete noradrenaline. Noradrenergic sympathetic supply. Sympathetic nerve fiber will go to the heart, will secrete noradrenaline and act on receptor and do few things in the heart. So what are the things that will do in the heart? It increase the heart rate. That we call chronotropic effect. You know, chrono is time, right? Chronotropic effect. Then it will increase the contractility. I hope you learn the contractility. If not, you will learn the contractility later. Contractility, that we call inotropic effect. And then conductive system. So I described the conductive system. I mentioned that AV node is the most delayed place in the conductive system in the heart. Sympathetic or this noradrenergic supply will reduce that delay. AV delay can be reduced and send impulse quickly. That we call dromotropic effect. So these three effects we can expect with the sympathetic noradrenergic supply. We have parasympathetic supply also. So basically this sympathetic supply will facilitate increased cardiac output, heart rate, contractility, and reduce AV delay. All will increase cardiac output. The cholinergic fiber, that is parasympathetic. That means probably you learn in the foundation module in the autonomic nerve system, we have sympathetic, parasympathetic. In the parasympathetic postganglionic neuron will secrete acetylcholine. And sympathetic postganglionic neuron will secrete noradrenaline or maybe adrenaline, mainly noradrenaline. So therefore, this parasympathetic system we call cholinergic fiber because it secretes acetylcholine at the receptor level at heart. And the cholinergic fiber will come through the vagus nerve. What the vagus nerve again? What is vagus nerve? Anybody? Vagus nerve? What type of nerve? Yes?
Cranial nerve.
Yeah, very good. So cranial nerve, so the cholinergic will come to the heart through the vagus nerve from the brain, cranial nerve. So we call cholinergic vagal fiber because it will come through the vagus nerve. So cholinergic vagal fiber means parasympathetic supply. So when cholinergic vagal fiber act on heart rate decrease. So all this sympathetic will increase heart rate and cardiac output. This cholinergic fiber will decrease the heart rate. So mainly attack to the heart rate, not like chronotropic, not the inotropic and dromotropic effect. But this vagal discharge, that means parasympathetic discharge, is the tonic discharge. So that is the main dominated supply to the heart rate and mainly for the heart rate is this vagal discharge, right? So therefore we call it a tonic. We call it a tonic discharge, and cardiac sympathetic is not that. Basically dominate this parasympathetic vagal discharge, dominate the cardiac, mainly heart rate control. In addition to that, heart can be controlled through the hormone also, right? Hormone, the main hormone coming from adrenal medulla, adrenaline. So adrenaline secreted from adrenal medulla will go to the blood. Through the blood, it will come to the heart muscles and act on receptors there and will do this chronotropic effect, inotropic effect, dromotropic effect. Basically, this sympathetic neuron, sympathetic nerve supply effect can can be enhanced or can do the same thing through the hormone coming from blood, and that is adrenaline, right? So adrenaline will act on basically same receptor. Right, so this diagram, again, I just want you to read and understand. I will not explain. It explain what happened, what are the action of epinephrine, norepinephrine, because their action is somewhat opposite in different places. So I will not explain, but please try to read them and try to understand, and you can find it in the Ganon. And probably not in the cardiovascular system, probably at the autonomic nervous system or adrenaline endocrine part, and try to understand this. Right. So later, try to answer these two questions. What are the main mode of regulation of blood vessels? What are the main mode of regulation of heart? Sympathetic, parasympathetic, hormonal regulation for the blood vessel, systemic regulation, neuron through the nerves and hormone, and local regulation through the metabolic active substance and locally secreting substance. So try to answer to these two questions. And if you can answer these two questions, basically you will summarize, you will understand almost everything that I will discuss up to here, right? If you can answer to these two questions per se, then anyway, you can do that later. Then I will come to the central regulation, right? So that is the commanding part, right? So we have local regulation that we cannot control externally, but we have systemic regulation for the blood vessels and heart. We can command, we can centrally coordinate that. So that coordination process I'm going to explain from here, coordination, right? So as I mentioned earlier, blood vessels, heart regulation can be controlled externally from commanding office or commanding center, but not this one. Right. So this central regulation, the place we call vasomotor control, the main area is located in the brainstem, medulla oblongata. Right. The medulla contain many area. Among that, most important place is RVLM, rostroventral medulla, or we call vasomotor area or vasomotor center, RVLM. Right. So RVLM can send sympathetic impulse to heart, blood vessels, and to the adrenal gland. From adrenal gland, it secretes adrenaline. Basically, it will sympathetic discharge to blood vessels and heart and adrenal gland. So, slightly complicated diagram, but just concentrate only RVLM. Both sides we have two. This one is the same, RVLM. So, from RVLM, you can see impulse or neuron will go to the spinal cord. From spinal cord to the sympathetic ganglia. You know, there are chain of sympathetic ganglia, and from RVLM, sympathetic outflow will go to sympathetic ganglia, right? So from sympathetic ganglia, it will go to heart and to the blood vessels. So when this place stimulated, it will send impulse through this pathway to blood vessels. Since it's a sympathetic discharge, main effect is vasoconstrictor through the alpha-1 receptor, alpha-1 adrenergic receptor, and send impulse to heart to do the chronotropic effect, that means increase heart rate, inotropic effect, increase contractility, bromotropic effect, so increase the conduction in the conductive system of the heart, right? So in addition to that, RVLM send impulse to the adrenal gland, and secrete adrenaline, and this adrenaline will circulate through the blood. Through blood, it can go to the blood vessels and dilate blood vessel. Through blood, it can go to this heart and act on the receptors in the different receptors in the heart, and will behave like sympathetic activation. So that is the job of RVLM or vasomotor control area. Just concentrate only that part now. Hari, මේ අනිත්‍යව බලන්න යන්න එපා. Right, RVLM, this part. Right, so just put a circle. So this RVLM and they are input to heart, blood vessels and adrenal gland. Right, so just concentrate only this part, and with the activation of RVLM, we can activate these things. Right, so right. Now, so when the RVLM or vasomotor impulse decreased, when the vasomotor center RVLM activated, it will send impulse to arterioles and constrict the blood vessels. Veins, venules, constrict the venules. So probably you remember I mentioned about the set of veins where that also can control through the neuron. So act on arterioles and venules, and act on heart. Chronotropic effect, increase heart rate. Inotropic effect, increase contractility. Dromotropic effect, increase the conductive system, conduction in the heart. And through the adrenal gland, it secretes adrenaline. So those are the action of activated vasomotor center RVLM. And when it is not activated, opposite will happen because less discharge will do this opposite of all these when we don't activate RVLM. So basically it has continuous process. Activation, inactivation, activation, inactivation. Right. So RVLM also get input. Right. So RVLM, this place cannot act itself. It should get the input from different sources, different places. Right. So let's see what are the inputs they get. So RVLM is connected to this place called NTS and CVLM, just some places. And this NTS will get impulse from different places. One is baroreceptor. So this is baroreceptor. Two baroreceptor, one from the carotid sinus and one from the aortic arch. So they will get information through NTS to the RVLM, basically this pathway, right? So this is RVLM, right? So it get impulse from carotid sinus receptor to the NTS, and then through NTS it will get impulse. You can see here negative mark. So basically this impulse will inhibit the RVLM. And from aortic arch also it get NTS, and through that it will also negative. Right. So basically stimulation of baroreceptor of carotid sinus and aortic arch will inhibit RVLM, will act as a negative effect. Oh, we can call it inhibit, right? Stimulation will inhibit. That is why I put here negative mark, right? So that is one input for the RVLM. Right. So just erase this. Right. So right. So RVLM get inhibitory receptor from information from baroreceptor. So baroreceptor is the main source of information that will go to the RVLM, that is inhibitory. In addition to that, in the lungs also there are receptors will do inhibition on RVLM, and cerebral cortex also there are some impulse will do inhibition of RVLM. Then RVLM will be excited by some impulse, especially from the chemoreceptor, right? There are set of receptor we call chemoreceptors. We have many chemoreceptors in several places. We'll send impulse and stimulate RVLM, and then pain pathway also stimulate, and cerebral cortex directly, hypoxia and carbon dioxide directly act on RVLM and excite the RVLM. So RVLM can be excited and inhibited. If it is excited, send impulse to this pathway. If it is inhibited, will not send impulse to this pathway and get inhibited all these things. Right? So that is what happened, action of RVLM. So little bit about baroreceptor. It's a stretch receptor located in the blood vessels, several places, and it's like a barometer, responds to the pressure, and will increase or decrease depend on the pressure that will get through the blood flow. Basically, it's a meter or receptor responds to the blood pressure. Right? Give impulse to RVLM, inhibitory impulse to RVLM, and stimulatory impulse to the cholinergic innervated nuclei that we'll call NTS. Right? So I will explain that also. Yeah, this one. Right? So when the baroreceptor stimulate, it will, earlier I explained this, where's my pen? This will go to this pathway and inhibit the RVLM. But for the cholinergic, that means parasympathetic neuron originate from this place, from NTS, we call nucleus special nuclei of the vagus nerve, and that is stimulatory. So when the baroreceptor stimulate, that will stimulate the nuclei NA and send increased impulse discharge to the parasympathetic supply through the vagus nerve. Right? So that also action of baroreceptor stimulate. So baroreceptor stimulate, inhibit the NTS and stimulate the NA through the NTS, and NA basically parasympathetic stimulation. So it's basically with the baroreceptor stimulation, sympathetic discharge will be inhibited and parasympathetic discharge will be increased. Right? So you can understand in the sympathetic discharge increase, it will do something. When the parasympathetic discharge increase, it will do the opposite. Basically, baroreceptor stimulation will do vasodilatation, venodilatation, and bradycardia as a result. Right? So you can later you can work out how baroreceptor stimulation through the two pathways will do vasodilatation, venodilatation, and bradycardia. Basically, it's a parasympathetic effect. So baroreceptor location and things you can read leisurely. And so the same diagram as I explained almost all this pathway now. And cholinergic innervation, so that is what I mentioned, this innervation through the nucleus ambiguous, right? So cholinergic innervation of the heart, right? That means parasympathetic supply will come through this pathway, will come through this nucleus ambiguous through the vagus nerve. This is vagus nerve, parasympathetic supply, right? Right. So baroreceptor stimulation stimulate the cholinergic fibers to the NTS and nucleus ambiguous NA and basically reduce the heart rate. Right. So try to understand this. Probably now it's little confusing with different pathways, and try to read these handouts again and you will understand that. Right. So that is the vagal pathway. As I mentioned, baroreceptor stimulation stimulate the nucleus ambiguous, nucleus NA mean nucleus ambiguous, and stimulate the parasympathetic supply and basically reduce the heart rate. Buffer nerve will act as a baroreceptor, baroreceptor will act as a buffer nerve and buffer in the blood pressure. So when we lost the baroreceptor, blood pressure will fluctuate like this. When we have baroreceptor, it will be less fluctuation, and read this, you will understand why we call baroreceptor nerve or baroreceptor functions buffer the blood pressure. Buffer again, you know, you learn about the pH, so it acts as a buffer nerve. And in addition to that, we have a special receptor called atrial stretch receptor. It's also like a baroreceptor, but located in the atria, type 1 and type 2. Type B is the important one. Discharge primarily in the late diastole and peak of atrial filling. That will also facilitate the vasodilatation and some help for the cardiovascular adjustment, cardiovascular regulation. Right. So again, some set of questions, try to answer them later. And about chemoreceptor located in some places related to heart, carotid body and aortic body, detect the partial pressure of carbon dioxide and partial pressure of oxygen, basically chemical factor. That's why you call chemoreceptor, send impulse to RVLM or vasomotor area. Valsalva maneuver, it's a maneuver or test we will do to check this baroreceptor function and basically cardiovascular regulation, right? So I will not explain that. You will have a practical, separate practical on Valsalva maneuver and read that, read the handout, and through that practical you will learn about the how the Valsalva maneuver operate and so on. It's very important test to detect the cardiovascular regulation, autonomic function, because basically cardiovascular regulation through the sympathetic and parasympathetic autonomic system, right? So baroreceptor action, and basically this diagram summarizes cardiovascular regulation described so far. All this, try to understand them. Blood pressure increase, what will through the vasomotor center and so on. Right, so that's in my lecture. You have 4 minutes left. If there's a question, you can ask. Yes, any questions you can ask. Of course, it's a relatively lengthy lecture. Read them, try to understand. So if there's a question, now you can ask. Right, so I don't want to take the next lecturer's time. So you have 3-4 minutes. Okay, so if not, I will stop and have a nice day.